Thank you for joining us for this week's episode of Mommy Talks with me, Catherine Karong'o. We are joined by Dr. Charles Muteshi to discuss about fibroids and the implications they have, if any, on pregnancy. Stay with us. We can begin with the definition of fibroids. What are they?
Fibroids are an overgrowth of cells of the muscles of the womb. So the womb is a uterus which carries baby in women. And when the cells of the muscle of the womb overgrow, they form little balls, and that is what is called fibroids. They are generally not cancerous.
How are they identified, or how can you identify that you have fibroids?
Fibroids diagnosis would be made by your doctor, and this would be a combination of having a physical examination. You may find that the womb is actually enlarged, but more specifically we would do a test such as an ultrasound scan, which is quite good in picking the fibroids, and it will tell you where they are located within the womb and their size as well as the number. And sometimes we have to do more advanced testing such as MRI, or what we call magnetic resonance imaging.
Are there specific symptoms that present that make a doctor advise a woman to go through the ultrasound to probably diagnose?
Yes and no, but mostly fibroids are found in the course of checking out or explaining a variety of symptoms. So there would be no specific fibroid symptoms, but commonly girls would come to us saying their period is probably heavier and more prolonged than normal. It may be coming out in clots. There might be a feeling of heaviness or a pelvic mass, as we call it, and you may notice, oh, I'm now having to increase maybe the size of my trousers, yet my weight hasn't gone up. There might be symptoms of pressure of the bladder or the bowel, and occasionally we find them when we are looking for causes of delayed conception.
In terms of data, what's the percentage of women that suffer from fibroids?
This varies, and it tends to increase as women get older. So women who are close to the menopause, nearly half of them would have fibroids diagnosed. They don't have to have symptoms from them, but about 1 in 3 women, possibly in their 30s to 40s, will be found to have fibroids. But again, not all of them will have symptoms of fibroids.
What about a younger age, younger than 30?
Yeah, we still have fibroids diagnosed in younger women, but it's kind of a rarity because they may be there, but they are quite small and therefore asymptomatic. Very occasionally we find they are causing symptoms and they're quite huge.
What implications does it have when you have fibroids? Do they interfere with conception? What are the implications?
So first of all, it's whether the symptoms that one has may be attributed to fibroids or not. And where we think the fibroids are causing symptoms, their location greatly matters. So we have 3 broad categories of where fibroids will sit within the womb. And we have what we call submucous fibroids. These mean fibroids that are within the womb lining. And this is the area of the womb that sheds every month and is seen as a menstrual flow. Those are fibroids that are more likely to cause bleeding problems, and to an extent they could have an impact on maybe implantation or miscarriage. Then we have what we call intramural fibroids. These are fibroids that sit squarely within the muscle of the womb. Again, perhaps their symptoms may be due to their size. So if they are huge and stretching and expanding the womb, they may cause significant health issues, but most of the times they may not if they're small. And then we have what we call subserosal fibroids. These are fibroids that are found on the outer surface of the womb. They tend not to cause lots of symptoms unless they are so huge, and sometimes they can be quite big, and that will be due to what we call pressure symptoms.
What is the treatment? What options does a woman have?
We treat when they cause problems, so not all fibroids require to be treated, and we also treat depending on the symptoms that are bothering. So if bleeding is the main symptom, then we will look and say, where are the fibroids located? If they are within the lining of the womb, what we call the submucous fibroids, and those are fairly easy to access because we would pass a camera through the neck of the womb. It's called hysteroscopic resection, and you don't need to have a cut on your tummy to have those removed. If they are within the muscle and they're significantly big, they may be removed either surgically by open surgery or laparoscopy. And if they are outside the womb, on the surface of the outside of the womb, then again they can be accessed either by open surgery or laparoscopy. Now, the distinction of whether to remove the fibroid plus the womb or not depends on childbearing desire, and of course the importance attached to the womb itself. So you might find someone who is not planning to have children, but they really don't want their womb removed. Now, I do mention surgery because we do not have specific medicines that can be taken to get rid of fibroids. Symptoms can be improved slightly, for example, heavy bleeding, but those are very temporizing. Then we have newer techniques, very clever, where you can pass a tiny little catheter, similar to the cannula we put through the vein when we are pushing down drugs, and that can be threaded very, very carefully towards the womb, and we inject special material into the vessels that feed fibroids, and that cut off the blood supply. So they we would starve the fibroids, and eventually they would shrink. So that's called uterine fibroid embolization.
There are instances where they've affected the conception, a woman's ability to conceive. Is it possible for them to be removed and you are able to conceive, and vice versa?
It has to be a very delicate balance, because always remember, for a woman to conceive, they also need the man to have a normal sperm count. So where fibroids are found in the workup of delayed conception, we mustn't jump to the conclusion that they might be causing the problem before we look at all the factors. And usually we look at the sperm count, we make sure the fallopian tubes or the tubes are open, and that there is ovulation, or the woman is releasing an egg every month. And if all these factors are normal and we possibly find fibroids, then we have to weigh the pros and cons of having them removed, because removing fibroids does not necessarily mean conception is going to be improved, but also there are risks associated with this operation, including losing the womb due to heavy bleeding.
Is it possible to live or to lead a normal life with fibroids if they don't have any symptoms? You're not having heavy bleeding or anything like that?
Lots of ladies do live a normal life, and as I said, 50% of the times there will be no symptoms, so you will really never know you have fibroids unless an ultrasound scan was done. And these cells that grow when the hormones are active, and they tend to regress their growth or shrink at the time of menopause. So you can literally, live through your life without ever knowing you had fibroids, and stop your periods at the menopause and really never know you had fibroids.
Thank you so much. Anything else you'd like to add?
I guess it's just the understanding that fibroids are quite common, and a decision to treat them has to be very carefully weighed and options offered, so that we think or believe together with the patient that treating what appears to be very obvious may help with the symptoms. For example, fibroids don't cause pain, and we know that a lot of girls will go through fibroid surgery because of painful periods, and yet that may not be the real cause of the pain. So it's good to interrogate the symptoms and look at the options of treatment and say, am I going to get some benefits by going down the route of treatment?
Thank you for staying with us. We hope that you've learned from today's episode. If you've not subscribed to the channel, please subscribe using the subscribe button below. You could also ring the bell to get notifications whenever we upload new content. Until next week, stay safe and goodbye.